Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Mrs. You've been referred to me because of some pain in your face. Now, I've got some notes from your GP, but perhaps you can tell me in your own words about the pain when it started and what's happened since.
Well, it began about 3 years back, out of the blue. I've got this terrible shooting pain in a back tooth. I've never felt anything like it before in my life, and see, it was a tooth that had a nasty abscess on it before, and I assumed that it got infected again. Anyway, I went off to the dentist as soon as I could get an appointment, so he did some x-rays, but he couldn't find anything wrong, which was very strange.
Was the pain continuous, and did anything in particular trigger it?
It came and went, and it lasted 1 minute. Just in the middle, so each time. But it really got bad when I brushed my teeth. I always use an electric toothbrush. They're so much better than the usual ones, but it didn't like that one a little bit. I even tried to persuade the dentist to whip the tooth out there, and then because I was so sure that that was the problem, but he told me he's pretty sure there was nothing wrong with my teeth at all, and I ought to see my GP.
And your GP has diagnosed trigeminal neuralgia.
Well, first of all, the GP told me to try painkillers. That was to exclude things like a migraine, I think. But the pills, they didn't have any effect at all. So then he sent me off for a CT scan because he said it might be a very bad case of sinusitis. I've had that before when I was a teenager, or he said even nerve damage. But that was all negative too. So then after all that, the GP eventually put me on an anti-epilepsy drug, which seemed to help.
So how is it now?
The pain sometimes goes away for a time, but then it can come back a dozen times a day. Fortunately, I get a tingling in my jaw, and it's going to start, which I can recognize as a sign, so at least I get a bit of warning before the pain comes on properly, and I can try to find somewhere quiet to sit down.
But the pain has now begun to spread, yes?
It started to happen in my eye, too, on the same side. I was doing okay until the firm where I work moved to a new office. The new building was fine at first until about 3 months ago when the weather started to improve and they turned up the air conditioning because lots of people were complaining about being too hot. That's when I started getting pains in the eye, and I'm pretty sure it's connected. But it's the same all over the building, and it's not as if I'm sitting in a draft. So there's not much I can do about it. I've tried wearing glasses all the time, and that seemed to help a bit, at least at the beginning.
And these pains in the eye, tell me how long they last and how often you get them.
It's getting worse and worse over the last fortnight. It's been every day and sometimes every hour and it's really excruciating. It's getting me down, and I've started losing weight to what with the worry and pain, and I've had to give up my yoga class, which I loved, because you never know when the pain is going to come on. And well, that's making me feel very isolated. I really hope you can do something more for me, doctor.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor.
Good morning.
Good morning. Please be seated. May I know your problem?
Well, doctor, I have multiple issues with my teeth due to severe dental disease. I have had many of my teeth removed. Now I have severe tooth pain. Both lower and upper teeth on my left side have been troubling me for the past 3 days.
What's your age?
I am 29, doctor.
What medications are you taking?
I'm taking OxyContin and Vicodin for my knee pain. I need more pain medication, but I do not want to use that medicine.
Are you allergic to any medicine?
Yes, penicillin and codeine.
Do you drink or smoke?
I do not drink, but I do smoke regularly.
Well, your test reports show temperature 97.9, blood pressure is 83, pulse is 84, respiration rate is normal. Oxygen saturation is 98% on room air and is interpreted as normal. Your mouth and oropharynx show multiple dentures and multiple dental caries. You have tenderness in teeth, numbers 212 as well as 21. Your gums are normal. There is no erythema or swelling. There is no purulent or other discharge noted. The floor of your mouth is normal without any abscess, suggesting Ludwig's syndrome. You have developed otalgia and multiple dental caries.
I am prescribing Dilaudid of 4 milligrams intramuscularly. I would suggest you go for filling treatment. The affected area will be drilled, the decayed substance removed, and the empty space will be packed with an appropriate dental filling material.
Okay, doctor, thank you.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
A major depressive disorder is one of the most severe, troublesome, and costly psychiatric diseases. Although there are pharmacological and non-pharmacological treatments, often antidepressants are used more frequently than psychological interventions due to inadequate resources. Our efforts are to promote the evidence-based prescription of these antidepressants in the future. Therefore, we are now focused to update and expand our previous efforts to compare and categorize antidepressants for treating a major depressive disorder. All antidepressants were more efficacious compared with placebos while treating the adults with a major depressive disorder. While the effect was lesser in the placebo-controlled patients, the variation in efficacy and acceptability was more in the patients treated with antidepressants. Therefore, these findings should promote the evidence-based prescription of antidepressants and apprise the physicians, patients, and policymakers on the mayors of various antidepressants. One of the most crucial challenges worldwide is the routine prescription of antidepressants for the treatment of a major depressive disorder. Nevertheless, in the scientific community, there are considerable ongoing debates about the effectiveness of antidepressants, as well as the potential differences in tolerance and effectiveness due to individual drugs. With the introduction of new antidepressants into the market and the increasing numbers of trials published every year, we have realized the significance of systematic review and meta-analysis to synthesize the evidence in this crucial clinical issue.
Now look at question 26.
Okay, so the next thing is about Susie Williams in bed 3. Right? She's been admitted for chest pain to rule out MI. So far she had an EKG, which was okay, and the first set of cardiac enzymes and troponins are negative. When she came in, her blood pressure was elevated a little, like 182/95, but she was given losartan, and at 6 o'clock it was 142/82. She was also dehydrated, so we started her on IV fluids D5, half normal saline running at 125 milliliters. That can go until midnight, and then it can be disconnected. She's scheduled for a stress test tomorrow and some more enzyme tests, okay?
Now look at question 27.
So what seems to be the problem?
I feel such a mess. I'm sure people think that if I just tried harder, I could lose weight. Maybe I need more willpower.
Well, firstly, well done for seeking medical help. Actually, being overweight or obese is a medical problem because being overweight changes how your body works.
Oh, thanks. But I do feel that it's my fault for being this way.
Well, I hear what you say, but please understand that these days we consider that obesity is a disease like high blood pressure or asthma. You see, the body's signals to the brain stop working correctly when you're overweight, and with time you feel less full even if you eat the same amount. And when you cut calories, your body tries to use less energy to keep your weight the same.
Now look at question 28.
Lupus is a chronic autoimmune disease in which the immune system becomes hyperactive and attacks healthy tissue, resulting in symptoms such as inflammation, swelling, and damage to skin, joints, blood, kidneys, the heart, and lungs. Normally, our immune system makes proteins called antibodies to protect and fight against antigens such as bacteria and viruses. However, lupus makes the immune system unable to differentiate between healthy tissue and antigens, which leads the immune system to direct antibodies against the healthy tissue instead of the antigens.
Now look at question 29.
Have we got Mrs. Kent's notes?
Yes, they're here. She's coming in today for possible laser surgery for her retinopathy, isn't she?
Well, depending on the results. And from the look of these pictures we took last time, there's been a slow improvement. So we'll talk to her and perhaps hold off for the time being unless her conditions worsen, which can happen in some cases.
So what's the cause?
Well, we know a leak of fluid behind the retina causes the distorted vision which some others get, but not why that occurs. There may be a link with stress and also steroid use, but the jury's still out, I'm afraid.
Now look at question 30.
Now I'll hand over to Jenny, who has a few words to say about staffing. Jenny?
Thanks. If we compare ourselves to other hospitals of the same size in other regions, we're actually recording lower rates of staff turnover. That's just as well, given the challenges filling vacant positions across the sector. Where we do compare unfavorably is in the number of days lost to sick leave. That's making it hard to maintain full cover on the wards. And we all know the costs of that. As a matter of urgency, then, HR is looking into the worst affected areas to understand the reasons behind it and to see if there's anything we can do to help and support the staff involved.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Hello, my name is Daniel Harrison, and I am a clinical psychologist working in the hospital. Today, I would like to share with you a case study that exemplifies the type of work I do daily. However, before we dive into the case, let's first understand the role of a clinical psychologist. Simply put, as a clinical psychologist, I work with individuals of all ages, helping them to manage their mental health and navigate their emotional and behavioral difficulties. This could be assisting patients dealing with anxiety or depression, or supporting adolescents grappling with learning or behavioral disorders. While a physician's first question might be, "What physical ailment are you suffering from?" my first question is usually, "What are your thoughts and feelings?" Now, let's move on to my case study. This case involves a patient named Alice, a 35-year-old woman who was struggling with severe postpartum depression. Alice, a successful businesswoman, had recently given birth to her first child. However, instead of joy, she experienced a profound and relentless sadness that made it difficult for her to care for herself and her new baby. When Alice was first referred to me, she was in a state of deep despair. The profound sadness and the guilt of not feeling the expected joy were overwhelming her. Many thought if Alice didn't willingly participate in her recovery, there wasn't much that could be done. But I didn't see it that way. With Alice, we started with what she felt comfortable doing. We talked about her life before becoming a mother, her work, her dreams, and her goals. I worked with her to gradually reshape her thought processes and help her recognize and cope with her feelings. We started small, with mindfulness techniques and mood tracking. Then, we gradually moved on to cognitive behavioral strategies to challenge her negative thoughts. Did the therapy work? In Alice's case, it was not a straightforward journey. She struggled with feelings of hopelessness and had difficulty seeing progress in her condition. There were moments when she broke down, believing she'd never get better. However, she gradually started to realize that if she didn't actively participate in her therapy, she'd be stuck in this state forever. This realization became a significant motivator. Alice attended therapy for 6 months, with many highs and lows. One particular challenge was when she tried to return to work prematurely. She had hoped that resuming her normal routine would help her feel like herself again. But the stress only exacerbated her symptoms, leading to a minor relapse. However, this setback also served as a turning point. Alice resolved to prioritize her mental health and work at a more manageable pace. I am pleased to share that Alice's journey did have a positive conclusion. She is now managing her symptoms effectively and has started to enjoy motherhood. She's also returned to work on a part-time basis, balancing her career and personal life. It's not been an easy journey, but her resilience is commendable. Seeing patients like Alice turn their lives around gives me immense satisfaction. It validates the importance of the work I do and the substantial difference it can make. Despite the challenges, the journey to recovery is always worth it. The strength and resilience that patients like Alice exhibit continually inspire me in my work.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, we're talking to Dr. Maya James, a neurologist and Alzheimer's disease specialist in the UK. Dr. James, can you tell us what Alzheimer's disease is and why it's often referred to as a silent epidemic?
Alzheimer's disease is a progressive brain disorder that slowly destroys memory and cognitive skills, eventually leading to the inability to carry out simple tasks. It's the most common cause of dementia among older adults. It's often called a silent epidemic because it usually starts with mild memory loss and confusion, which people sometimes dismiss as normal aging or stress. This results in the disease often being diagnosed at a later stage, making treatment less effective. As our population ages, we are seeing more and more people affected, with an estimated 50 million people living with Alzheimer's worldwide. However, funding and research for Alzheimer's lag behind other diseases of similar prevalence and impact.
Are there concerns in the UK about Alzheimer's?
Yes, absolutely. The UK, like many developed nations, has an aging population, which means the prevalence of Alzheimer's is increasing. We have an estimated 850,000 people living with dementia in the UK, most of them with Alzheimer's disease. These numbers are predicted to rise significantly over the next couple of decades. The impact of the disease extends beyond those directly affected to caregivers, healthcare systems, and society at large.
Can you share an individual case for our listeners?
Certainly, I had a patient, let's call him Robert, who was a retired professor. He was very active, even after retirement, participating in academic conferences and delivering lectures. However, he started noticing that he was forgetting names and important dates, something that had never happened to him before. His wife also noticed that he was becoming increasingly confused about familiar routes while driving. After a series of tests, he was diagnosed with early-stage Alzheimer's.
What are some of the challenges in treating Alzheimer's?
Well, let's take Robert's case as an example. After the diagnosis, he was quite devastated and had difficulty accepting it. The available treatments for Alzheimer's can help alleviate some of the symptoms, but can't stop the progression of the disease, which can be difficult for patients and their families to grasp. Furthermore, managing the disease is a long-term process that requires careful monitoring and adjustments to the treatment plan. The journey can be emotionally and physically taxing for both patients and caregivers.
Do you also deal with patients in the later stages of Alzheimer's?
Yes, I do. In fact, one of my patients, let's call her Dorothy, was in the later stages of Alzheimer's. When she first came to see me, she was already having difficulty recognizing her family members and could no longer perform basic tasks like dressing herself or preparing meals. Her condition continued to deteriorate, and she eventually required round-the-clock care.
What can be done to combat Alzheimer's generally?
Research is key. We need to continue to study the disease to understand its causes and find more effective treatments. Prevention strategies like maintaining a healthy lifestyle are also important. Early detection can lead to early intervention, which can slow the progression of the disease and improve the quality of life for those affected. And finally, increasing public awareness about Alzheimer's can lead to more timely diagnoses and reduce the stigma associated with the disease.